Thanks so much for joining me on the Slice of Healthcare podcast. How are you today?
I'm great. How are you? And thanks for having me on.
Yeah, I'm excited for us to chat. Um, how's everything going so far? Good week.
Well, yeah, it's everything. All time blurs together during the pandemic. If we were, to identify this podcast at a point in time, I think we've all been in this together for the past year, so it all just kind of blurs, into one long day. I feel like at this point, but I will say that you know, with what we've been doing, we've been able to do a lot of positive work and, help more people than ever. So I feel like every day and week that we've been able to, kind of work through things in this little area of healthcare we're in has been a blessing.
Absolutely. Absolutely. Well, I think we should dive right into it. I'd love if you could start off by telling the audience a little bit about your background, and then we will talk about PursueCare.
Sure, absolutely. So, hi, listeners. My name is Nick Mercadante. I am the CEO and founder of PursueCare. I am a healthcare attorney by trade, or sometimes I say at this point, a reformed attorney. I've been working in behavioral healthcare for the better part of the last decade. Got my start sweeping floors at 6 years old in my father's pharmacies. My father is a 40 plus year veteran of the pharmacy industry. So I learned a lot about healthcare, kind of grew up in a family that, revolved around really healthcare. My mother was a lab technician. So, I think it was always kind of like the all paths lead towards working in healthcare for myself as well. And my sister ended up in the same place. And my brother was the only one that I think was, I don't know, smart maybe, and got into art and went in a different direction. But we all ended up working in healthcare. But before I started PursueCare, I was first general counsel and chief compliance officer, and eventually president and COO of MedOptions, which at the time was the largest behavioral health provider in the country in skilled nursing facilities. So we would integrate behavioral health care on site at nursing facilities, psychiatry care, psychology, mostly for geriatric elderly populations. But we actually pretty frequently would run into, especially in rural areas, we'd run into challenges both with scarcity of availability of behavioral health care, and then also a lot of substance use disorder and dependence, even at the nursing home level, which you don't typically kind of equate with that. So that's part of what's got me on this path to launching PursueCare, was seeing some of the struggles that would come with trying to get behavioral health and substance use disorder treatment in rural areas, and kind of set us on our path towards this company. So it's a little bit about me from a work standpoint, but aside from that, I've got a wife and 2 kids and 2 dogs, and whenever I do have free time, I play or watch hockey, and that's pretty much what occupies me.
Oh, you still play?
Yeah, poorly, but yeah, yeah, I do. I grew up, I played hockey my entire life, so I still have to get out there and putter around at this point.
Nice. Yeah, it's I could never. I like watching hockey, but I could never figure out how to stop on the skates, which can be very dangerous if you're trying to play hockey or just go skating. So I used to just slam into the boards every time I wanted to stop. And you only can do that so many times before you're like, I don't want to do this anymore.
Yeah, this hurts.
This hurts. I actually, funny. So I used to always use at the gym. They had like an ice skating simulator, like the machines where it would you could actually decrease the resistance.
Yeah. Mm-hmm. Yep.
And I used to love doing it, and that would strengthen every part of your leg. But But see, I could stop. I could just get off.
Yeah.
That's why I liked it. So
It's that those are a great workout. It's funny. There's a lot of people that are in, there's like hockey shape, and then there's everything else. And a lot of people, even, former hockey players, they might get in the best shape of their lives, but if they haven't been playing hockey for a long time, they get out on the ice within like 30 seconds, they're sucking wind, because I think it's partly it's like the muscles you use, and it's that everything is like a series of sprints all over the ice. So it's just exhausting. So, through this pandemic, they shut everything down. We couldn't play anymore. And so just recently, in the past few weeks, myself and some of my buddies finally got out to play. And it was pretty pitiful, because none of us, even the ones that had kept in shape, we had not been playing, organized hockey. And it was, it was pretty embarrassing, I'll say.
Well, let's just focus here now. So thank you for your background, by the way. Really appreciate it. I'd love if you could dive more into detail into PursueCare. Kind of give us, I guess, the why, how, and what of the company, if that's all right.
Yeah, absolutely. So, I mentioned that we kind of were born out of, or the concept came out of some prior work, and a lot of our management team came with me to this new venture with PursueCare. They came with me from Med Options, and really at the heart of it, I think, is a mission statement, like any good company, any good startup. And our mission, just in very basic terms, was to try to lower or remove the barriers to access to evidence-based and high-quality healthcare for people with substance use disorder, and also people that experience dual diagnosis, psychiatric issues, and to do that for the most vulnerable, or I guess underserved populations, is kind of paramount to our initial launch. We wanted to do this in rural areas where really this other pandemic that we have, which is the opioid crisis, was most prevalent and most profound. So, when we were starting to kind of put together the concept of it, it was a kind of a peeling back the onion exercise, because we were looking at, like I mentioned, in the nursing home space, we were seeing almost like this spillover of people with substance use disorder in nursing homes, places they shouldn't be, places you wouldn't equate for the type of care that they need. They were getting basic nursing care there. They weren't really getting anything for long-term success or long-term positive outcomes. And then as we started to look at, some of the other factors, all of the breakpoints in healthcare, lack of access, high degree of stigma, and then just your basic barriers, like how do you spend 4 hours a day going to the clinic? That's very hard. How do you hold down a job or take care of your children when you're doing that? And the hours are between 9 and 4 o'clock instead of, maybe on your time in the evening after work. And the supports aren't there when you need them. The supports aren't there on a tough Friday night, at 11 o'clock at night. So all those things kind of played into why we started it. We got off the ground in 2019. We're venture back, so we were able to get some seed capital. Our co-founder is Tom Menigan, who is the CEO Emeritus of the American Pharmacists Association. His thought process was to bring pharmacy in as a driving factor in addiction treatment, because we're believers in what evidence shows is the most effective form of treatment, which is MAT, medication-assisted treatment. So at the core of the offering of PursueCare, we have doctors that can prescribe medication-assisted treatment therapies like buprenorphine. We've got counselors and therapists for whole person care. We have psychiatric providers for comorbid dual diagnosis mental health issues. We tie everything together with care coordination. So we have folks that kind of act as advocates and case managers in care, helping, quote unquote, the trains to run on time. And then we have our own pharmacy as well that can ship medications directly to the patients. And we deliver all of our care through a smartphone app. So patients can access their doctors, they can do live telehealth, they can get other digital resources to help them in treatment, and really do all their treatment on their time at home. So we've been at it now, in earnest for about a year and a half. Obviously, the pandemic really kind of threw gasoline on an already burning fire. So I guess a silver lining, if you want to call anything a silver lining, is that we've been able to help more people than we could have imagined, faster than we had planned. And we ended up we launched in 2019 in West Virginia and Kentucky, and now we're in 10 states. We're about to be in 11 states. So we've gone through this rapid expansion and growth, and really done a lot of great work. I think our best work is with the existing infrastructure in the community. So we work heavily with hospitals, health systems, primary care, community health centers, any place that acts as a front door for people with substance use disorder, but maybe doesn't have the next transitional step for those people. That's where we come into play. We create collaborative partnerships with those organizations to help transition them into our care at home. And that's been able to, really kind of create some really positive outcomes for our patients.
Thank you for sharing that. Yeah. Interesting. You're in a truly great space. And because there are so many of those like front door, as you said, opportunities, right, that you're able to work with them and to help. What are some of the things that you're really excited about for moving forward, I guess, this year?
Yeah, well, so I think, I've been doing a lot of seminars and webinars about what's coming next, after the pandemic, whatever that means. And I think the biggest thing is obviously there's been broad deregulation in this space, removing of a lot of the barriers. More has happened in the past year with that than in the past 20 years. And I've been doing telehealth projects on and off since 2004. So I can confidently say, that the world has really changed in that regard. I don't have to explain what telehealth is anymore. I don't have to sit here and tell you, what does that mean, right? What I'm most excited about, honestly, is that I think that digital health is here to stay. And now it's about innovation and really improving the outcomes for patients, just in terms of what you can offer and the things. And it's not just things that are in the treatment room, so to speak, but it's kind of the elements of hybridized care where you can offer digital health solutions, devices, telehealth, remote patient monitoring in between your visits with a doctor. That's incredibly powerful for everybody. It's great for the patient, for engagement and feeling like you're going somewhere, but it's also great for the healthcare providers that, are trying to advance better outcomes. So I think that really is probably the most exciting thing for me. And being at the forefront of some of that innovation with what we're doing is, it's cool. And it's fun to share that, not only with our patients, but with the broader healthcare community where they go, oh my gosh, we want to be a part of this. This is exciting. So I think that's really the neatest thing that has happened really in the past year, with all this.
Yeah, thank you so much for sharing. And I just want to let the audience know, this is our first episode together, right? So the goal is to have you and other members of your team come back on. We kind of dive into some specific areas of the company, but today was really getting to know you, talking through the company, giving that background description and what you're really excited about. So I look forward to the additional episodes we put together. And I want to thank you again so much for joining me on the podcast and look forward to those future episodes.
Awesome. Thank you for having me on, and thanks for letting me share the story a little bit.